Joining me right now is the Vice Chairman of the National Transportation Safety Board, Bella Dinh-Zarr. Thank you so much for being here.
Thank you for having me.
Let's talk about this idea of why injuries in transportation are such a huge public health issue.
Well, people often don't think about transportation as an issue in public health, but actually we all get around. We use transportation every day. And what we do at the National Transportation Safety Board is try to figure out ways that people can get around safely, whether they're flying, on a boat, and on rail, but really now one of the biggest public health issues is motor vehicle injury prevention.
And that's one of the things that you're talking about in the panel session today, alcohol and drugs and how it impacts transportation and really increases the accidents.
There are so many issues in injury prevention related to motor vehicles, but one of the biggest is the use of drugs and alcohol while driving. Alcohol alone, that's responsible for 10,000 deaths a year. That's 1/3 of the 30,000 plus people who die on the roads. And now people are using prescription drugs, also illicit drugs. All of that is really contributing to what sometimes we call an epidemic on wheels.
One of the things that you often see in the signs on the highway are, put down the electronic devices, because that really has become a huge issue with regard to accidents as well.
That's right. So distraction is a huge issue. That's actually on our NTSB most wanted list. We have a list of things, and impairment is also one of them. But we're increasingly in a more technological society. We use technology for everything, which is wonderful. And there are many things that it'll help us stay safer with. But sometimes we don't acknowledge the fact that it's very distracting, that we should be focused on the task of driving or operating if we're a pilot or a train. So really focusing on the task at hand. And that's why we've made it one of our most wanted lists of things that we need to focus on for transportation safety.
One of the other things that you focus on are giving people options for transportation, and one of those, as it relates to public health, is really active transportation, getting people to move themselves, whether it be bicycle or otherwise.
Yeah, and I think we all want to move around in ways that we want to. So we want to have that freedom. We want to be able to walk or bike or take public transportation or drive to get around and take our children to school and go to places. So what we do is we try to make those options as safe as possible. We make recommendations. We investigate accidents. So you'll often see us on the scene of a crash, whether it's an airplane crash, a school bus crash, the ship that recently sunk. And we're trying just to recommend so that people will implement ways to make those modes of transportation safer. And as for active transportation, it's great to be able to walk and ride your bike, but you want to be able to do so safely. And that takes planning, that takes making sure that people in communities prioritize those activities.
When you talk about safety, I don't think most people realize that motor vehicle accidents are the biggest threat to public health. It seems shocking, but really a call to action.
It is. I always think of it as one of the unknown, hidden epidemics in public health. We are losing more than 30,000 people a year in the United States alone, and over 1.2 million people in the world. So that's a huge number of lives lost, and not to mention the injuries, the long-term impact of a serious, debilitating injury. So motor vehicle crashes and the prevention of them, I think, should be a public health priority for everyone.
Exactly, and I think it's partly a matter of getting the word out and helping people realize that that's the case to try to affect some change.
And there's so many ways we can do this. That's the wonderful thing about the American Public Health Association, APHA. We are all different types of public health professionals, but we have one noble purpose, and that's to keep the public safe and healthy.
And that's a great purpose. Bella Dinh-Zarr, thank you so much.
Thank you.